Do you know ballpark or even a specific number, how many you prescribed?
Couple hundred, and 95% have been better in 24 to 48 hours.
That was Dr. Ryan Cole on the day he was confirmed as the lone physician on the Central District Health Board. He took the place of Dr. Ted Epperly, whose tenure was not renewed by Ada County commissioners after 15 years because, as Commissioner Ryan Davidson said, "I think Dr. Ryan Cole has some interesting ideas." Well, that day, August 17th, 2021, Dr. Ryan Cole spoke to us from the Boise airport on his way to spread some of those ideas. Ideas that have now officially earned him a statement of charges from the Washington Medical Commission. The statement of charges is basically a list of accusations based on and put together after investigating complaints filed with that commission. Dr. Cole, who is a board-certified anatomic and clinical pathologist and has a laboratory in Garden City, has been a licensed physician and surgeon in the state of Washington since June of 2007. Those charges against him were released today, and they lay out why the Washington Medical Commission believes Dr. Cole had a widespread negative impact on the health and well-being of our communities. The 11-page report claims Dr. Cole made numerous false and misleading statements during public presentations regarding the coronavirus pandemic, COVID-19 vaccines, the use of ivermectin to treat COVID-19, and the effectiveness of masks, saying they were harmful and dangerous to people who wore them, and generally generating mistrust in the medical profession and in public health, the statement read. And then it goes on to give specifics. The commission listed 19 times Dr. Cole said things that were either misleading or flat out lies, such as, quote, children survive COVID at 100%, or asymptomatic spread is, quote, infinitesimally small. Ivermectin is a, quote, known antiviral medication, end quote. Or the spike protein in the vaccine is a toxin, and there's no evidence masks prevent the spread of the virus. Those are just a few examples. In fact, Dr. Cole claimed masks increase retained carbon dioxide in people's bodies. The statement also pointed out the times he said stuff like this.
What we have right now is an experimental biological gene therapy immune modulatory injection. mRNA trials in mammals have led to odd cancers. mRNA trials on mammals have led to autoimmune diseases, not right away, 6, 9, 12 months later. 50% of healthcare providers are absolutely not getting this injection, and that's a reason. We don't trust the data.
I don't even like calling it a vaccine. An investigational vaccine. A fake vaccine, okay. I can a clot shot, a needle rape, whatever you want to call it.
This is a dangerous gene-based shot that is not a vaccine. We cannot scientifically recommend this to anybody. I mean, I am adamant about this. This is the hill I will die on. The children are a no-go with this shot.
Okay, so that last sound was from a Central District Health Board meeting in May of last year. Dr. Cole wasn't able to attend that meeting in person because he was in London, spreading more of his interesting ideas. The statement of charges then went into specifics on how Dr. Cole prescribed medications to 4 different patients, something the medical commission called negligent because, they say, Dr. Cole prescribed medications not approved for a COVID infection. He failed to properly document justification for those prescriptions, didn't advise those patients of other treatments available, and treated those patients beyond his competency level. In other words, he was doing stuff a pathologist shouldn't be doing. They also claim Dr. Cole didn't document any medical history of these patients, nor did he perform a physical exam on them because, the charges claim, he did it all over text message, not in person and not over video in a telehealth session. The 4 patients detailed in these charges covers their interaction with Dr. Cole during the summer of 2021, from June and July, right before he got appointed to the CDH board. And all 4 of those, for all of them, Dr. Cole prescribed ivermectin, just based on information they told him over an instant message chat format, which is not allowed based on the standard of care in Washington. One of those patients, identified as patient C on July 6th, complained she had energy issues and felt like she was having a heart attack. This is someone who had no history with Dr. Cole, just reached out to him out of the blue, asking for ivermectin. According to the statement, it was prescribed by Dr. Cole, who said it may help with her energy issues. Dr. Cole then also allegedly told her if ivermectin did not help her, he would prescribe a steroid to help with the energy thing, which is not a standard treatment for such conditions. He apparently didn't even ask her about her heart issues. Then when the pharmacy failed to fill her ivermectin prescription, patient C tried to follow up with Dr. Cole, and he never responded, which is the same claim from another patient. The Dr. Cole prescribed ivermectin and then ghosted them. He didn't provide any follow-up care. So these are the 4 official charges against Dr. Ryan Cole from the Washington State Medical Commission. Based on unprofessional conduct, a violation of state code which entails any act of depravity, dishonesty, or corruption, incompetence, negligence, or malpractice which results in an injury to a patient, misrepresentation or fraud in any aspect of the medical profession, and even interference with an investigation or disciplinary proceeding by willful misinterpretation or misrepresentation of facts. I did ask what this last charge meant, if Dr. Cole interfered with this investigation in any way, and we have not yet heard back. Now, these are only statement of charges against Dr. Cole. As of now, no action has been taken with regard to his medical license in Washington. Dr. Cole has until January 30th to respond. And as for what that response might be, we did reach out to ask, but we were told Dr. Cole was traveling out of country for the next week, again with the interesting ideas, and he's unavailable for comment. He and his attorney are working on a response to the Washington charges, including presenting scientific data to support his claims and patient care practices. We do know he has previously referred to complaints and public attacks as politically motivated. We also know, despite a complaint being filed against Dr. Cole with the Idaho Medical Association, that case was closed without any action being taken. And even if there was, we likely wouldn't know what that would be because of Idaho's rules to protect doctors that keep such things quiet.